morning. I'm Candace Willett, pediatric nurse practitioner, and I'm here with Dr. Jemsek. We are practicing providers at the Jemsek Specialty Clinic in Washington, D.C., and we just wanted to put together a short little video as a follow-up to our very popular Facebook Live series and featured topic from last week discussing kind of some big red flags in early childhood observations that we've collected over the last 20 years of practice that we think it's valuable to share with families to help them protect themselves. So during our Facebook session, we had an opportunity to kind of go through 20 to 30 observations that we've accumulated throughout practice over the last 20 years. And because it was so much information, we really wanted to have an opportunity to break it down today for you, but also share how we will also publish it so that it can be seen and families can have this as a resource.
Good morning. Thank you, Candy. I've been very fortunate. I've been in D.C. now 11 years, before that many years in Charlotte and South Carolina. Most people know my journey, but I love it here. And since being here, I've been very fortunate to have two nurse practitioners. Tara Fox, who's moved on to get a PhD in nursing and was here for 5 years, and now Candy. And of course, they know a lot more about pediatric medicine than I do. So I just want to give a little background on what we started to observe, because what we do is all observational, looking for patterns, paying attention, listening to patients, and gathering information, not discarding anything a patient would say, however bizarre. Because many times it turns out to be something that we didn't know about, and we learn. I remember talking with Tara and understanding that there may be harbingers of disease in pre-adolescence in particular. So I remember the first few talking points, which were sleepwalking, excessive enuresis, headaches in young men or young boys, pre-adolescent, delayed puberty, and of course not meeting milestones. So we started looking at that handful of markers and suggest that this may be a reflection of future issues with tick-borne illness, chronic inflammatory disease. And we also learn from our existing patients who are adolescents or young adults or older adults as they go through their childhood. And sure enough, we're finding those things as they recall in their childhood. So this is a service to parents and our young patients in that for the first time we'll be posting a whole set of markers and conditions that may reflect inflammatory disease affecting the nervous system, the joints, and so forth. And it's never been posted before, it's never been published before. It will be trademarked simply because it's intellectual property. It's not that I'm obviously sharing it, and Candy is sharing it, so we want you to have it. It's just that, I don't know, we want to take credit for it because there are many things we've done that other people take credit for, and so trademark's not a big deal. It's not a money-making thing either. So it's just, this is Jemsek, and guess what? It's going to be expanded. It's not perfect. It's just our first edition, if you will, and we continue to learn. So it's a privilege to post this, and it will be posted in a few days, and we'll make an announcement about it so that you'll have something to go back on our website, and it'll be on Facebook, I'm sure, as well, that you can look at and think about. And hopefully be helpful in terms of trying to understand the evolution of this very complex illness in our youngsters.
So as Dr. Jet mentioned, this is the document that he was speaking about. It will be posted so that you can thoroughly review it. It breaks down based on age group, really starting at newborn and going all the way through adolescence. And to start, we provided some information on our Facebook Live session just about how families can protect themselves and really prevent transmission of tick-borne illness to a newborn, to a fetus particularly. We won't be going over those recommendations today, but please feel free to review our Facebook Live session for those recommendations and/or ask us questions at any time. To start, newborn is obviously very vulnerable. And so newborn stage is usually from 0 to 2 months of age or so. And looking at particular markers, some that have become very clear to us over the years has really been considering failure to thrive in an infant, how well they're feeding in particular. Are they gaining weight? Are there any concerns there? Others also relate to their esophagus, and yet it could be immature, but thinking about, are they having a lot of reflux? Are they spitting up frequently? Often that's followed by primary care. Another one that's become very clear, fever of unknown origin, and this can happen for very young infants too. Their immune system is immature. However, it's something as a red flag to really consider. And then starting from there, it progresses throughout the months, monitoring how well that infant is meeting milestones and achieving success. So this is the document that Dr. J had mentioned and that we've compiled. It will be shared online for your review and consideration. The title of it is Observational Review of Signs and Symptoms in Pre- and Post-Adolescence, which may reflect emergence of Lyme Borreliosis Complex or LBC infection. The other topic that we will be discussing in the future and haven't really touched too much on is really mood and emotionality in our younger patients, and that's absolutely something we'll be focusing on in the future. And I'd like to transition to Dr. J at this time.
Well, thank you, Candy. So it's a tough subject. It's not my wheelhouse, but we do have access to experts. And I just want to make a comment about Candy and prior to that, Tara. Their job is really difficult because they're in effect taking care of three people. They're taking care of the youngster, whatever age group, and they're taking care of two parents, sometimes one parent, but at least one parent, sometimes 1.5 parents. So somebody's not on board. So I just acknowledge that you have a tough job. It's really difficult. I mean, parents are distraught about, what's going on with their child. They've heard different things. They've been on the doctor trail. They come here, what is this Lyme? Most people don't believe in it, and so forth and so on. And the psychiatric aspects of this will be discussed in a little more detail on the 27th, I think, Thursday, on our next live stream with Jules Capon, who's back. Jules did a marvelous job on our 7th live stream. She is a counselor and has a whole range of patients with borreliosis. She's beloved and very competent, so we welcome her back, and we'll certainly delve into this a little bit more as we go forward.
So many of our patients already understand the definition of Lyme Borreliosis Complex, but we wanted to kind of break it down for those who do not understand our diagnosis. What we do on a regular basis, evaluating new patients as they come in, children and families. So we'd like to break down that definition for you so that you can understand really just how complex this disease is. Dr. J, would you help us with that?
I'll try. I coined the term Lyme Borreliosis Complex many years ago as a succinct way to talk about an illness that has multiple pathogens, affects multiple systems, and I have a term called multi-compartmental neurologic disease, and it's also immunosuppressive. So it's a widespread disease capable of involving not only the nervous system, but by virtue of its inflammatory mass and being constant, we've become immunosuppressed. The immune system is playing catch up the whole time, making noise, making you miserable, damaging tissue, but not controlling the infection. So in our youngsters, there are many, the whole spectrum of mood disorders that we can talk about later. But I can just tell you for the young ones, and Candy has confirmed this, right? That
yes, absolutely.
I have a little mood building that I talk about. So I like to use my hands to demonstrate, and patients need to understand. They're trying to tell me a story or Candy a story, and the children are trying to tell you stories too, which can be very difficult. Mm-hmm. Anyway, our mood building, first floor is irritability. So everybody is irritable, including the kids. Mm-hmm. Irritable. That's where you start. Second floor is frank anger, maybe some anxiety, and sleep deprivation. Third floor is panic disorder, frank depression, and fourth floor can be dissociation, psychoses, hallucinations, and so forth. But it starts with irritable, so everyone is irritable. So poor Candy has to deal with a child that's not happy to be there, be here rather, and parents that are anxious and oftentimes skeptical.
Sure.
Why are we here? So there's a lot of calm dialogue and introducing the subject to Candy, and I think for all our patients, and the parents in particular, they're impressed by the time taken to get the history, get it right, and do a thorough examination, which makes all the difference, folks. I mean, there's no shortcut here. And so I applaud Candy, and before her terror, for dealing with 3 patients at one time on each visit, and all the mood issues that will be discussed further. I think that's very important. We'll probably get into therapy as well, and I may borrow some thoughts from Dr. Bransfield, who I mentioned before is the world's expert in Lyme borreliosis. Again, I call it Lyme Borreliosis Complex. People are using that term widespread, and it simply reflects, again, polymicrobial infection. That means many different pathogens: Babesia, Bartonella, Mycoplasma, Chlamydia, Proteomyxoma, overgrowth with Candida, gut issues, biofilm issues, and the absolute necessity to stabilize our patients in terms of life functions, essential life functions, sleep, pain, mood, and look at laboratory work, which with chronic inflammation, there are often many outliers. So those have to be repaired or replaced, which is not very hard, but it needs to be acknowledged, especially the adrenal axis. And those things, the poems that's on the POEMS acronym on our website discusses that. So if you want to go to our website and see what we're talking about, I think it'll make sense. And I've been doing that since year one, recognizing that there were different life functions that were critical. It was critical to stabilize them, not perfect them, but stabilize them so they can be treated. Candy, do you have any further comments about that?
Oh, I'd really like to thank Dr. Jemsek for sharing all that information, because it's valuable. And he's absolutely correct. We take our time with our patients and our families because we learn from them, and it's important to gather as much information as possible to treat them and help with stabilization and reassure them too that we know what's going on and we're here to help, and that it's such an honor to be able to work with children and families, to be able to do that, and to work with the providers here and collaborate with Dr. Jemsek, because that's how we get our patients well and how we protect our families.
Yeah, getting our patients well is such a reward. I mean, that people say, well, how do you do it? And you've been through so much. And, when people have challenges, it's just one step at a time, right, folks?
Mm-hmm.
Many of you out there have tremendous challenges. We'd like to help. We realize it's hard to access care. On the website, I do have guidelines to help you with doing basic things. I forget the title, but it was composed not quite 2 years ago. And it's a beautiful book. I wanted to do a version 2, but the version 1 goes through things anyone can do that if they can just get out of bed, they can do stretch and tone, they can do foot baths, they can meditate, they can do intermittent fasting. All of that's in there. And these are things that help reduce the inflammatory load. If you can reduce the inflammatory load, you're going to have a better day. Okay, we're not treating the infection. We're not talking about that. You're not in active treatment, but you can have a better day. And so in that way, I hope I've been able to help thousands of people who didn't know that gluten should be eliminated, for example. Sometimes we make the assumption people know all these things, and a lot of times they do, but a lot of times they don't. So, but our reward is getting people better. It's, oh my gosh, we get a young person better, and they're back in school or back in sports, and the neurologic symptoms are slowly improving, and now the patient is healing. And young people do well for the most part. Obviously, there's a group that are more challenging, but for the most part, young people, they get better. I mean, they have young immune systems, they have more flexibility, and
they bounce back a little bit better
and
faster than the adults.
Right, and so And when you see the patient, you have a very good sense of this patient's going to do well,
Absolutely.
right? Because you'll have parental support. So one of the poems is other, which includes other conditions, but mainly support. So the parents have to be involved, or the caregiver, or whoever is responsible for the patient, youngster, has to be involved and committed. And we try very hard to make sense of what we're doing and outline why we're doing things, and that we do have a plan. You know, we don't just say, let's try this for a while, let's try this for a while, let's try this for a while. That's not good. You have to have a plan. You have to be flexible within the plan, which is what we try to do.
Absolutely.
But
coordinated effort.
Yeah,
Right.
coordinated effort. It's a team effort, and has to be
Absolutely.
for youngsters or adults,
Yeah.
or elderly. It has to be. We won't treat a patient who doesn't have support. It just won't work. So that's one of our poems criteria.
Absolutely.
But you can tell after the first visit whether somebody's going to do really well, or probably well, or we've got challenges, right?
Absolutely. There's many different clues.
Right.
Yeah.
And if you feel very good about it, you impart that to the parents, right, and the child.
Sure do. Yeah.
Child.
To reassure them.
You know what,
Yeah.
David, you're going to do well. I can just tell you're going to get better and heal. It's going to take a few months, and you just have to be a good patient, and we're going to give you a few simple things to do, and please try to do that. And I'd love to see you back in 3 months or 2 months, or we'll do a phone call or whatever. But you can tell, and I can tell, we can all tell. One of the items that we're working on our Facebook and website are we've listed like 25 conditions that either preclude or corrupt treatment so that people can't get better. And so it's very important to know what conditions will do this if you're treating these complex patients. And we're the only ones that have a list like this. And I think there are 25 items. And we haven't posted them on the website, but I'm going through them by groups of 3 or 4. I've done that on live stream. And we're going to continue to do that and try to include it as part of our future live streams, just a few minutes on these different topics. And eventually I will post it, and we'll have it up there. And again, it's not perfect. It's never perfect, and it's evolving. But you see that too in your kids. I mean, besides satisfying POEMS criteria, you'll see other conditions that have to be addressed before we can initiate treatment.
Definitely. Different barriers as we go through assessment.
What's one of the more common things you see? So POEMS.
Sure.
They have to be sleeping, pain, they have to have support, labs have to be okay, and their mood has to be on the playing field.
Yeah.
So there are other barriers. Can you give an example of?
Sure. So just a very basic example would be, we ask all of our patients, how are they doing cognitively? So that extends to, our children, how are they doing in school? Is school supportive? Are they aware of what's going on? How can we set them up for success to either potentially take a medical leave if it's warranted, or to perhaps set them up so that there are accommodations so they can be successful and maintain some type of stability there academically.
Right. We have to look. That's a really good one, because child may have to lay out for a year or two, and we're writing letters to the school, and this applies to college students.
Absolutely.
I mean, they take a gap year to get better, and so we have to assess what are the stresses of continuing education or your work, and in some cases, it's actually better for patients to continue doing some work at a reduced level, usually, in school or in their job place, because it's more stressful for them not to work. So that's an assessment that we have to weigh all the time. And so when you talk to a child, they may just take some time off, or a lot of times arrange for homeschooling or tutoring or something of that sort.
Absolutely.
Right?
Yeah.
Okay.
We think about what would assist them through treatment best, and who they
Right.
are as an individual.
And we're constantly trying to build resources, right, for people that we can refer to, whether they're psychologists, child psychologists, or social workers or counselors,
Absolutely.
to help the process. So JSC, we depend on lots of other people, other professionals. We love to collaborate with other professionals and learn from them, and they learn from us, quite honestly, quite often. And it's a growing process. So it's really all about being patient-oriented. If anybody knows my history, you'll know I'm all about the damn patient, okay? Patient first. Our patient population, whether it was HIV, AIDS, or LBC, has been marginalized and ridiculed, and that makes me furious, and I stand up, and everybody here stands up for the patient. Because the medical landscape is not friendly much of the time. Now when I have an opportunity to collaborate with somebody's mind is opening, that's wonderful. Recently, I've had an experience where we've had some very good doctors that I've conversed with talk about Lyme, like, oh yeah, it's Lyme, and my Lyme patients are really tough, and I can't really do much until their Lyme symptoms are better, and so forth. So it's really, so it's evolving. COVID has put a huge blanket on the evolution of LBC education, but that's another story.
I think that's a great segue where we can transition to thanking you for your attention today, and please feel free to check us out, review the website, check us out on Facebook for our live series. The next one upcoming will be with Jules Capon, discussing with Dr. J, again, some of the mood symptoms that we just briefly touched on today, but we'll expand at that time. And just really want to thank you for your time today, Dr. J.
Well, I want to thank the people who are listening, and thank you. So we'll see you soon, and always enjoy imparting information. We're trying to be professional. I wasn't snarky today, not one bit. Trying to be professional and educational and help our listeners. So bless you.